Right, I have provided privacy to the patient. Hi, Mr. Peschke, how are you?
Good, how are you?
Good, my name is Riley and I'm a nursing student at Open University. So today I will be doing an assessment of your neurological and musculoskeletal systems. So to start, I'm going to wash my hands and then ask you a few questions. What is your first name?
Matt,
And then your age?
44,
Do you know where we're at right now?
at the doctor's office
And then why we're here?
for physical.
Okay, so you answered all four of those correctly, which means you are alert and oriented ×4. And then for history, have you ever had any head injuries?
No.
Or any bone fractures?
No.
Muscle tears or ligament or tendon tears?
No.
Okay, and then currently, do you have any muscle pain?
No.
Or joint pain?
No.
And then any weakness in your muscles?
No.
Or numbness or tingling?
No.
Okay, so now we will be moving on to the physical assessment, and that's going to be starting with your cranial nerves. So we're going to look at cranial nerves 3, 4, and 6, which are ocular motor, which controls pupil size and reactivity to light. Abducens and trochlear are 6 and 4 respectively, which move your eye around. So I'm just going to have you take off your glasses. Now hold this up to your eye to see what size your pupil is. Looks to be about a 6 millimeter, which is appropriate for the dim lighting. And then I'm going to shine this in your eye, and I'm going to have you look straight forward. And we're going to check for reactivity and accommodation on the other side. Okay, and then the next side. So both sides reacted and accommodated appropriately. Your pupils are both symmetrical and the same size. And then now we will be moving onto your eye position using cardinal positions of gaze. So go ahead and follow my finger. Okay, so that is completed. There's no signs of nystagmus or any eye twitching. So now we will be moving on to cranial nerve 5, which is trigeminal, so that controls your jaw. So I'm going to feel and have you open your jaw and then clench down. Okay, so strength is even on both sides. Cranial nerve 5 is functioning properly. And now 7, which is your facial nerve. So I'm going to have you smile, and then you can stop, and then raise your eyebrows, and then puff out your cheeks. Okay, you were able to complete all of those, which means that that nerve is functioning. And then we will move on to 11, which is your spinal accessory that controls your shoulders. So I'm going to have you shrug your shoulders up against my hands. Okay, you could push against my resistance, which means that nerve is working well. And then 12 is your cranial nerve hypoglossal, so that controls tongue. So I'm going to have you stick your tongue out. And then it is midline with no deviations to any side, so your cranial nerve 12 is working well. And then finally, we're going to go to your cerebellum. So I'm going to do rapid alternating movements. I'm going to have you put your hands down on your thighs and then flip them up. And then just keep doing that as fast as you can. Okay, good. So you were able to complete that, which means your cerebellar function is good. So that is all set for your neurological assessment. Now we'll be moving on to musculoskeletal, starting with your shoulders. So just looking at them, they are in line. And I'm going to palpate here. So does any of that feel tender?
Mm-mm.
Okay. So if you could go ahead and stand up for me, we're going to check your range of motion. And I just want you to follow my movements.
Okay.
So I'm going to have you flex them forward and then extend them back. Okay? And then we're going to adduct them away from the body and then adduct them back. And then put your arms up like a goalpost and then internally rotate them and then back for external rotation. All right, good. So you have complete range of motion in your shoulders. You can go ahead and have a seat. Now we will be checking out your elbows. So I'm going to take a look at both of them. So they are both consistent color with the rest of your body. And then I don't see any swelling on either of them. And then palpating them, does any of that feel tender?
Mm-mm.
Okay. So now we're going to check your range of motion. So just follow me again. You're going to flex them and then extend them. And then I'm going to have you hold them out to the side like this and then turn them pronation and then supination. Okay, good. So you have complete range of motion in your elbows. Now we're going to check their strength. So I'm going to have you hold your arms out like this, and I'm going to press against you. Don't let me do it. All right? And then I'm going to pull. Don't let me pull on you. Okay, good. So your muscle strength on both of your arms is equal, and it is both a 5+. So moving on from that, we're going to go to your wrists and hands. I'm going to have you hold them out. So color is also consistent. I don't see any swelling, and then I'm going to feel on this side. So does any of this feel tender?
Mm-mm.
All right, and then what about this side?
Mm-mm.
Okay, good. So now we will be testing your range of motion there as well. So I'm going to have you flip your wrist down for flexion and then up for extension. And then for your fingers, you're going to flex them and then extend them and then adduct them and then abduct them. All right, good. So complete range of motion. And then for grip strength, I'm going to have you grab both my hands and squeeze as hard as you can. All right, good. So you have equal muscle strength on both sides of your hands. It is a 5+. And then we're going to check your pulses, starting with your radial, right there. So that rhythm is even in a 2+, and now on this side, even in 2+ as well. And now we're going to check your brachials. All right, even 2+. Even 2+ as well. So your arms look good. So we are going to move on to your legs. If you could go ahead and lay back for me, you can rest your head back on the pillow. So when we're looking for legs, we're making sure that your iliac crests are aligned, and they are, that your legs are aligned and they're equal lengths. And then looking at your knees and your ankles, I don't see any swelling. And then when I touch here, do you feel any tenderness?
No.
Okay. And then on this side?
No.
Okay. And then we're going to check for pretibial edema. So I'm going to press right here on your shin. And then on the other side. And there is no indentation, so there's no signs of pretibial edema. So now we're going to check your capillary refill. So I'm going to grab one toe and press. And then they both refilled in less than 3 seconds, which means you have adequate blood flow to these areas. And now we're going to check your pulses, starting with your dorsalis pedis. So I'm going to feel right here on your foot. So that is a 2+ and even, and then on this side as well. Also 2+ and even. And then your posterior tibial, which is right here on your, next to your medial malleolus. Even and 2+. And then this side, even rhythm and 2+. All right, so we're going to check your range of motion on your hips and your knees. So I'm going to have you bend your knee up and then bring your knee as close to your chin as possible. All right, good, and then you can extend it all the way back out. So that was your hip and knee flexion and extension. And then go ahead and do the same on this side. And then you can go ahead and extend it. And then for this leg, I'm going to have you bring it out from your body. And then you can bring it back in. And then same on this one. Out and then back in. All right. So your abduction and adduction are sufficient. You have complete range of motion in your hips and your knees. So you can go ahead and sit back up. I'm going to have you stay just like this so we can check your foot range of motion. So I'm going to have you do dorsiflexion, so you're gonna flex your feet up, and then plantar flexion, which is down, and then invert your feet, and then evert them. Okay, so you can, I'm gonna check your foot strength here first. So go ahead and press down like you're pressing on a gas pedal, and then resist my hands up. Okay, and then I'll have you come forward so that we can check your hip strength and knee strength as well. So I'm gonna press down on your thigh, resist, try and pull up, okay? And then this side as well. Okay. So your hip strength is a 5+ as well as your ankle strength. And then I'm going to press on your shin here, and I want you to try and bring your leg up. Okay? And then same on this side. Okay. So you have a 5+ knee strength as well. So everything looks good on here, full range of motion, full muscle strength. So I'm going to have you stand up and we'll check your spine. So go ahead and turn around. I'm gonna have you hold, we'll just hold it like this. So looking at your spine, it's aligned. Your cervical spine has the concave, while your thoracic has the convex, and then lumbar concave, and sacrum and coccyx convex, which is the contour that we want to see. And then I'm going to feel all of your spinous processes. And then I can feel every one. Did any of that feel tender?
Mm-mm.
Okay, you can go ahead and put your shirt down. So now we're going to check your range of motion on your spine. So I'm going to have you flex forward,
Like, touch my toes?
like just like this. Okay? And then you can bend back, and then this back. Okay, good. And then we're going to have you rotate, and then rotate to the other side. And then we're going to check your lateral flexion, so just bend to the side, and then the other side. Alright, so complete range of motion there. Everything looked good. And then lastly, we're going to check your gait. So I'm going to have you walk to this chair over here. And then come back. Okay, good. So your posture was good, your gait was even and steady, so everything looks good there. And then that completes my assessment. So do you have any questions for me?
Mm-mm.
Okay, great. Well, thank you for your time. And then if you have any questions, you can let us know. But if not, then I will see you soon and have a great day.
You too.
Thanks.